This is Group 1's presentation on the 1918 influenza pandemic. Group members are Catherine Burke, Destiny Bibbs, Fariha Hassan, Tia Bell, and Joanna Broyles. This is an introduction about the influenza pandemic. The 1918 influenza pandemic was the most severe pandemic in recent history. In fact, more people died from this strain of influenza in a year than in 4 years of the bubonic plague from 1347 to 1351. The cause of the flu is the H1N1 virus, and it is of avian origin. However, we cannot determine a country of origin due to it being in the past and not great records. So the spread around the world began during 1918 to 1919, right during the time of the First World War. But it was first discovered in military personnel in the US in early 1918. In the end, an estimated 500 million people around the world were infected. That was nearly a third of the world's population at the time. There were at least 50 million deaths, and the most affected populations were those 5 years and younger, 20 to 40 years old, and 65 years and older. Healthy people, especially in the 20 to 40-year-old range, were particularly susceptible. Okay, so what is the historical context of the influenza? So it was born towards the end of World War I in March of 1918, nearly a year after the United States entered the war. The United States detected the first outbreaks of 1918 influenza. Over the next 6 months, the flu spread sporadically through America, Europe, and Asia. The second wave hit the United States in September of the same year. This particular wave was the most fatal and is the reason for the majority of the deaths associated with this pandemic. Also, another reason for the amount of deaths is that there was a shortage of nurses during the fall of 1918 because of military deployment to military camps and abroad for the war. An estimated 195,000 Americans died just during October of 1918. And during this pandemic, many cities were struggling to control the disease and contain their dead. The end of the war caused another resurgence of the influenza as soldiers were sent home and families began to celebrate the end of the war. In the end, the virus is believed to have infected 500 million people worldwide with at least 50 million deaths, and about 675,000 people died just in the United States. This is a little appropriate, but because there were no vaccines against the influenza and no antibiotics to prevent secondary infections commonly associated with influenza viruses, the world had to rely on non-pharmaceutical interventions such as isolation, quarantine, use of disinfectants, public gathering limitations, and face masks. Sounds a little familiar.
The world population in the 1900s through 1927 was between 1.6 billion to 2 billion people. Our world data states that the population was 1.8 billion in 1918. At least 1/3 of the population got infected. In 1918, the U.S. population was between 103 million people, and in the U.S., 675,000 died from the virus.
All right, so how did this 1918 influenza pandemic affect populations? So approximately 50 to 100 million people died, as stated earlier. And with the mortality rate being higher among the healthy population, which is those aged 20 to 40, made this pandemic unique compared to other ones. As stated before as well, many social events like sporting events were canceled and people were warned to stay at home and quarantine and also wear masks. Apartment sizes correlated to the morbidity of those aged 20 to 29 in that healthy people range. In the summer of 1918, those who lived in a 2-bedroom apartment had the highest morbidity, while the winter after in 1919, those same people who lived in those apartments had the lowest morbidity, and those who had lower socioeconomic status were most affected by the influenza during the first wave. And this group was also the highest had the highest mortality rate. And during the second wave, those with higher socioeconomic statuses had higher morbidity.
Similar to what Destiny was talking about with the impacts from the 1918 flu, there were variable responses throughout the U.S. which were determined by local authorities. Vaccines were attempted but were unsuccessful, and eventually people lost trust in each other and the authorities because of the uncertainties and the contradicting messages that they were receiving. There were 3 waves of the 1918 pandemic, with restrictions tightening over time. During the first wave, the U.S. was involved in World War I, so the initial response was mostly nothing. There were more restrictions during the second wave that came later in August, and the third wave came the following year. There's a few important examples we can look at to see the different response strategies and their results. The first example that we'll look at is the response to Seattle's mayor, Ollie Hansen. Hansen took swift action, and within the first few days of the outbreak, he had closed schools and theaters and prohibited people from large gatherings, similar to the approach that we're seeing right now. Many people wore masks, but the layered cotton likely didn't do anything to protect anyone. A few months into the pandemic, Seattle thought it had defeated the virus, so Mayor Hansen lifted the restrictions, but the flu came back. Then he forced quarantine on people that showed signs of illness. And because of the tighter restrictions, 6 months after the initial cases, Seattle was on the road to recovery. The following fall, in 1919, the flu came back, but with fewer cases. New York City also took a proactive public health approach to the outbreak, which resulted in a better response for the community. They outlawed spitting in public, staggered working hours, and canceled public events. Whereas in Philadelphia, they did very little to add social distancing and precautions. And as a result, there was a tremendous spike in cases, as we can see on the right side of the graph on the screen. A Philadelphia newspaper even went as far as to say the outbreak was not a public health measure and there was no cause for panic or alarm. We can compare this response to St. Louis, seen on the bottom of the graph. St. Louis had a flatter curve and remained in control of the outbreak because there was a very short period of time between the first case and the enacted quarantines and social distancing. So there's important lessons to learn from the 1918 H1N1 pandemic that can be applied to the current pandemic.
So next we're going to talk about risk communication, and risk communication is essentially effective, timely, and clear communication to the public about an outbreak, and it consists of giving factual information or statistics on the number of people affected, areas that are most impacted, and also like the number of death tolls. And what's important to consider is that this outbreak happened during the First World War, and so wartime censors prevented publication of specific information as they really wanted to focus on increasing morale and publishing positive information, and publishing information about diseases wasn't really considered positive. So the first country, I guess, to publish it was Spain, as they were a neutral party in the war, and that's kind of why it got coined the Spanish influenza, because they were the first to publish about it. So people were like, oh, it must have came from Spain. But as someone mentioned before, the first case was actually found in America. But basically, because of the lack of communication to the public and this, explaining the severity of the virus, it became one of the most deadly viruses that we've seen thus far. And so, again, this is representative of failing to effectively communicate with the public and the impact that that does have on the population. So this graphic says coughs and sneezes spread diseases as dangerous as poisonous gas shells, and the spread of Spanish influenza menaces our war production. And I feel like this is exemplary of how governments worldwide were trying to keep people's mind off the virus and push them to be productive and continue with their contribution to war efforts. Also, calling it the Spanish flu kind of made it seem like it wasn't the responsibility of Americans, or any other citizens for that matter, to take measures to protect their own health and the health of others. And so basically with like war raging and the introduction of quarantine measures such as shutting down like movie theaters, as someone previously mentioned, many people harbored negative emotions regarding the pandemic and regarded the pandemic rather stoically, which is kind of to be expected after experiencing the hardships of war. And again, this is reflective of how appropriate measures weren't taken to convey information to the public.
Some of the key lessons that were learned were prior planning, clear orders, consistent and transparent advice and information to the public. Also, do not let up on social distancing too early because it can cause a spike in rates. Young, healthy people can also be victims as well. And don't use unproven drugs to treat the virus before an actual antidote is made to treat it.
So prior planning basically entails having some sort of framework or template in place that helps address a pandemic such as the H1N1 flu virus. And so an example of this would be like the national response framework that we talked about in class. And just being able to effectively address the problem, because we do know that it's another flu pandemic is going to happen, just don't know a matter of when. Clear orders, again, this is reflective of basically a bit of risk communication and how we respond to pandemics or the flu virus. So like having clear, consistent orders that are uniform throughout the nation so local leaders know how to respond. Risk communication is very important, so like consistent and transparent advice and information to the public. Because of war going on, there was a lot of war censorship, so there wasn't enough information given to the public about the severity of the flu. So it's important to give that information to the public so they know how to proceed, so they know how severe it is, so they can adhere to laws and regulations passed or rules passed by local authorities or like national authorities. And there's an understanding and a basis as to why these drastic measures are being taken. The next one is do not let up on social distancing too early. Certain places in America quarantined, so it's not really a new practice, but we learned, or what we can learn from that is giving up on social distancing or quarantine measures too early can have a negative impact and result in a lot of deaths. Again, young and healthy people can be victims as well, so basically meaning that like we have young fighting soldiers that got the influenza and brought it back to families and brought it back to loved ones, and like it was considered very deadly. Lastly, unproven drugs to treat the virus. They did have a couple vaccines that they tried out. None of them were proven, but they tried it anyway, and it proved to be unsuccessful. And it's just really important to remember that sometimes just because a drug may work for something else doesn't mean that it'll work for this. And I know we've seen this in like COVID-19, like using certain drugs that actually showed or have shown like poor health outcomes in individuals that used it versus those that did it. So just being like cognizant of that, or even like self-treatment or like self-therapy, avoiding use of that, and relying on protective measures until we do have a virus or a vaccine that's proven to work.
Thank you guys for watching our presentation, and we hope you learned something. Thanks.